I was aware about some kind of symptoms like diarrhea, urgency going to the toilet. I had a colonoscopy. My consultant was aware about some negative results from those colonoscopy, and that's when I was contacted.
Patients notice a variety of symptoms, but often a change in bowel habits, so looser stools going more times a day than normal, maybe some blood in the stools, occasionally abdominal pain or weight loss or changes in their appetite. Often one of the first tests you might have is something called a colonoscopy, which is where we put a tube inside your back passage and it's a camera and it looks round the bowel, and that might be the first time that we see the bowel cancer and inform you of the diagnosis.
At that point, we would try and come and meet you after that procedure to go through the report. If we weren't able to, I would contact you, or one of our team would contact you the next day by telephone and make sure you understood what was going on. So that would be our first meeting, and we would give you all our contact numbers and support you from then on.
I agreed to receive a phone call with the results. I had that call from the hospital saying, "Thomas, can you have a chat for a minute? Are you driving now?" And yeah, I stopped the car and we had a conversation about that. So that's when I was told about this. I was in shock for the first few days after this message, and I would struggle, to be honest. I would struggle to cope with that message. I thought I could be a little bit stronger, but it wasn't that easy.
When you come to clinic and you meet myself or one of the other consultant surgeons, and we talk about your diagnosis, if it's been made, and the surgical or other treatment options. You're really welcome to bring someone to clinic, a friend or relative, and actually that's often really helpful because it can be a lot of information to absorb, and it's often nice to have someone there to go through things with you afterwards.
The consultant was very honest with me and very open. I was told that I needed surgery. I was told that I will need chemotherapy as well after that, and I was told that I will need to have a stoma bag. I was aware about all the rates, about how many people being diagnosed, that I'm not the only one person being diagnosed, so that was something what helped me to think positive.
When you meet the surgeon at that initial consultation, he would go through, or she would go through, the consent form, and then on the day of surgery that would be revisited to check you understand what's going on.
There's lots of people that you can talk to. So you can talk to us in clinic as the surgeons. There's a colorectal cancer nurse specialist whose contact details you'll have, and you're welcome to phone them or email them at any time, and they'll get back in touch with you and can talk through any concerns that you might have. Your GP is also there in the community to talk to, and here at the Churchill we've got the Maggie's Cancer Centre, which will give you more information about when you come to clinic, but it's a great on-site resource for our cancer patients and their families.
Share with your family what's going on, so they can support you, and after surgery, accept help from people. People want to help, and even if it's coming to put the hoover around or giving you a lift to a hospital appointment, people want to help.
Depending on where your bowel cancer is and what stage of cancer it is, there are different treatment options available, but that's likely to be either surgery or chemotherapy or radiotherapy, or often a combination of the three.
Your treatment is decided at a multidisciplinary team meeting, and at that meeting we'll have the surgeons, we'll have the oncologists, radiologists, pathologists, one of us, the specialist nurses, will be there, and we would go through all your results, and as a team they would decide the best treatment for you. Prior to the actual date of surgery, you'd need to come to pre-assessment. So pre-assessment can happen at any point in the month, 6 weeks prior to surgery. The pre-assessment nurse would go through the medications you take. She would go through your past medical history with any surgery you may have had before, any pre-existing conditions you've got. She would probably do a set of blood tests, height and weight, blood pressure, pulse. They'd always do an ECG, and if anything flagged up on any of these tests, then they may refer you to different teams just for advice. But it is usually quite a routine appointment to go through all that. But also what they would do is give you a guide of what to bring into hospital with you, what time to come in, where to go, all the practical details they will give you when you come to the pre-assessment appointment.
Some patients will have a stoma bag, which is where the bowel is brought out onto the tummy wall and the faeces go into a bag. Our incredible stoma nurses will help you learn to manage this, and there's lots of help in the community for patients with a stoma. For patients that don't have a stoma, you might notice a bit of change in your bowel function, so you might go a bit more frequently than normal, but we'd hope that you'd have good control and good continence.
If there's any chance that you need a stoma, one of the stoma nurses would come down after your pre-assessment appointment and go through what having a stoma means, what they look like, how you would manage them. We don't get every patient to see a stoma nurse because most of the time stomas are not needed.
What was great for me, I think, all kind of activities, outdoor activities, running. I remember I jumped on my bike. I had a 3-4 hour ride, and I think that helped me to switch off a little bit, to stop thinking about that. And then, of course, the support from the family, which was great. I was very scared about the outcome from the operation, but at the same time, I was only thinking about the positive sides, like having that cancer away from me, being a healthy person again. And that was the most important for me just before the surgery.
On the day of surgery, you'd come to theatre direct admissions, where you would come in, meet the anaesthetist and meet your surgeon again, who would run through what they've already told you and go through your consent form again. You'll be given a gown to wear, and then all your belongings will be locked away while you go to surgery.
Just saying goodbye to my wife, that was something I'm gonna remember. That was something really, really bad feeling. And then I met my consultant, had a chat with her, then pre-assessment with the nurse. I was on my way, and that was kind of my first experience. I never had a surgery before, and having an anaesthetic, that was something, wow, yeah.
On the day of your operation, when it's finished, you'll go into our recovery unit and you'll be there for a couple of hours just being kept safe and waking up from the operation. That night, you'll either go back to our specialist colorectal ward, which is called Wytham Ward, or you might go to our high dependency unit called CORU. This is the Churchill Overnight Recovery Unit, where you'll spend the night after the operation receiving one-to-one care.
After your surgery, you'd spend a while in recovery, and once the anaesthetist is happy and the surgeon is happy, then you would go up to the ward. Somebody will contact your next of kin to let them know how things are.
I remember that I was at the recovery unit and the nurse was next to me, and I thought I'm somewhere around the seaside or at the coast, and I was asking for a pizza, that kind of thing I remember.
So most patients having colorectal surgery will have a catheter, so a tube going into the bladder for urine for the night after the operation and maybe a day or two thereafter. For most people, we'll remove it on day 1 and we'll encourage you to get up and out to the toilet as soon as possible to get body functions back to normality. It's likely that you'll be enrolled in our enhanced recovery programme. We know that this gets patients better more quickly after surgery. This will all be explained to you in clinic, but it entails on day 1 getting up and out of bed, sitting out in the chair for the majority of the day, walking round the ward with help from our physiotherapists and nurses. We'll suggest that you drink plenty and that you start to eat, but you'll be given thorough guidance on what diet is best for you depending on what surgery you've had.
You'll be reviewed by a physiotherapist who'll give you some exercises and make sure you're up and out of bed in good time. If there's any problems, she may refer you to an occupational therapist as well, just so that we can keep you active and get you assessed to get you home as soon as possible. You'd be in hospital for 3 nights up to maybe a couple of weeks, all depending on the type of surgery you've had. At any point, we're a point of contact for you, and if your family have any concerns while you're in there, obviously very welcome to contact our team, and we can always find out what's going on for them.
I remember I started feeling pain. I think the first night was pretty okay. Then the second day after the operation, I started feeling pain a little bit, but there was a great support from all the staff.
There will be some pain following surgery, but we take great care in trying to control this with analgesia, so pain relief. Sometimes that's tablet, sometimes injection, and sometimes it's a special button for patient-controlled analgesia that you will be able to administer yourself.
All the nurses at the ward, that was something amazing, something that I'm going to remember till the end of my life, really. All the support that I received from them and all the good stories, they were really, really supportive at the hospital. First day when I realized that I got a stoma, I had a visit from the colorectal nurse day after the surgery, and I was crying like a baby. I didn't like it, but then when I realized that this small bag saved my life, I start looking at this aspect from a completely different direction. So I was lucky to have a stoma, and I pretty like my stoma at the end of the day.
We'll really help guide you as to what you can do to optimise your recovery after surgery. Sometimes that entails doing things beforehand, such as stopping smoking, maybe engaging with a weight loss or diet or exercise programme, which is called prehabilitation, that we can help you with. After surgery, we'd really want you to engage with physiotherapists, but we'll guide you as to what you can do to help improve your recovery.
I was on a diet at the beginning, loads of fluids, not really solid foods at the beginning, and then I was slowly just getting up to the normal food like before the surgery. I lost loads of weight after the surgery. I think that was around 10 kilograms because I didn't eat a lot during my visit in a hospital. I remember that I was pushed by the staff at the hospital to start walking as quick as possible after the surgery. So less than 48 hours after the surgery, I was back on my feet with the support from my wife, from the staff at the hospital, and I start walking on a ward.
When it's time to go home after your operation, we'll make sure you've got a thorough discharge summary explaining everything that you've had done for both you and your GP. We'll also ensure that you've got the contact details in case there's a problem. So for the ward, for the colorectal fellow, and for the surgical emergency unit at the JR in case there are any issues.
You won't be discharged home until you're eating a light diet. You need to be opening your bowels, at least passing wind. You need to be comfortable and not in pain. So once those criteria are met, then you'll be allowed to go home. The things you should look out for are things like if your pain's getting worse, if you're not opening your bowels, you're not able to eat very much and your weight's falling, if you notice any bleeding, any rectal bleeding, all those sort of things that are new and are getting worse, then please contact us. After surgery, you'd come back to meet your consultant surgeon for the results. If you need chemotherapy, then we would refer you to one of the oncologists to talk about that. If you didn't need any further treatment after your surgery, you'd come to our specialist nurse clinic where we would manage your surveillance over the next 3 years.
Your recovery will continue at home for about 6 weeks. Normally people are off work for 6 weeks. We say you shouldn't drive for that period and avoid lifting anything heavier than a full kettle. But we can give you specific guidance on return to exercise or work depending on you, your fitness and what operation you've had.
Just eat little and often, light meals. Don't have lots of fibre or fizzy drinks or spicy foods. Just keep it quite boring and light, but we will give you plenty of advice on this before you go home. There are certain foods you cannot eat if you have a stoma, but the stoma nurses will give you a diet sheet about that. You may need to be taking some painkillers initially, but hopefully they would gradually stop. And the other thing, when you go home, we discharge you on some injections which thin your blood, which you have to inject into your thigh or tummy for 28 days after discharge. After surgery, you will feel very, very tired. So if you need to rest, that's absolutely fine, but we would say try and keep active, even doing a little walks around the garden to begin with. Just keep active and doing little walks and then building that up over the days and weeks.
My main piece of advice for you as you start on this journey is to use all the resources that are available to you. Reach out to us if you have any concerns, or the specialist cancer nurses, connect with other patients, and you can use other platforms outside the hospital, such as Octopus, the Oxford Colon Cancer Trust.
The option to come back to the normal life after the surgery, like going for shopping, going for a longer walk, or going back to work, that's really helped me mentally to come back to the reality. You're not alone. You're not the only one person going through the surgery. You can expect a great support from the hospital staff in Oxford, in Banbury, and don't worry about that. Don't worry about having a stoma. It's something normal. It's something pretty cool actually at the end of the day. It's something that's saving our lives.